Hi everyone, it's Dr. Ashu Goel from Integrated Spine Pain and Wellness, and today I have the pleasure and fortune of treating my very good friend and colleague, Dr. Meg Byrne, who's an extraordinary chiropractic physician in town and acupuncturist. And so she's coming to me with some back pain issues and some left hip pain issues. So today we're going to be using her body's own natural healing abilities with PRP, platelet-rich plasma, and some of her anti-inflammatory proteins that I can concentrate, and we're going to inject them in different parts of her body to treat her issues.
Hey guys, Dr. Meg Byrne here. I am a chiropractor and acupuncturist in Scottsdale, and I am here today getting PRP treatment by Dr. Ashu Goel, and I'm so excited. I had an unfortunate injury in my low back 2 years ago, and I sought his care then, and I was a little hesitant to do anything more invasive than I particularly go towards. As a chiropractor, I really try to stay with movement-based healing, but sometimes that is not the way to go when you hit bumps in the road. And so that's where I am now. After 2 years of physical therapy, chiropractic, acupuncture, I made a lot of progress, but I still don't feel perfect. And I know it's capable of healing. And so I just need a little boost, and that's what I'm doing here today. A little bit about what I went through. I herniated my L5-S1 disc. That was 2021, and it had a lateral component, which means that the jelly of that disc shifted to my left side when it bulged. And so my symptoms included sciatic pain and numbness down to my left foot. My low back pain was about like a 6 out of 10 pain, but the nerve pain down the leg was much more disruptive to my life. An oral steroid helped reduce that numbness very well, actually. And then I really worked hard on strengthening, and I was able to get my pain down to about a 3 in my low back, but the sciatic pain into my hip and my thigh has just been unwilling to leave my body. And so here we are. And so I'm really looking forward to getting the PRP treatment to help my nerves heal and my disc decrease that inflammation. So for those who don't know what PRP is, it is a procedure where the doctor, and you guys will hopefully see that today, draws my blood, and then he will spin my blood down to a concentrate that is very rich in growth factors and healing properties, and then that is injected back into me. However, the importance of making sure that you are as healthy as you possibly can be is going to dictate how well your results are. And so for the past 2-3 months, I have not drank any alcohol. I have kept a completely gluten-free diet. I also have increased my water intake a lot, about 180 ounces every day, and increasing a lot of just vegetables and things like that, and reducing as much sugar. And so hopefully my blood is crystal perfect, and so it will have so many good properties to help me heal. Just had a successful blood draw. My IV is ready to go. I'm so excited to have this procedure because for the last 2 years, as I've mentioned, I've been suffering from low back pain with sciatica. This has interfered with every aspect of my life. Fortunately, I do best when I'm standing, and I have a job that I get to stand all day, so that is the biggest blessing. Sitting is the most difficult for me. Driving in a car is very painful. I have flown many times over the last 2 years, and I have to bring a low back pillow everywhere I go so I can make it on an airplane comfortably. I've also had to limit a lot of my exercise and activities. I started playing pickleball, but I can't really do that with confidence right now. And so I'm most looking forward to getting back to activities and a plane ride without a low back pillow.
Those procedures are important for the first week or two. Just take it easy. Let your body go through the healing phase. That's very important. There's an initial remodeling phase that occurs along the ligaments, and some of the tendons will be injecting, and the risk of injury is increased for the first 2 weeks. So we don't want to re-injure those areas. So important, take it easy. Light walks are okay, things like that, but no planking, no stretching or anything like that, okay? End of week 2, beginning of week 3, you can begin physical therapy exercises.
Okay.
And we start off slow and kind of work our way up over the next 4 to 6 weeks
Okay.
back to your normal level of activity
Sounds
as
good.
tolerated.
Thank you.
When we do PRP, we customize each treatment to each individual patient. And so I use all the different components of the plasma depending on what I'm treating. This is all platelet poor plasma. What that means is there's no platelets in here. This is platelet rich plasma. So this is what I'll be injecting in other areas of the body. With this platelet poor plasma, I can run it through this special filter, XLPC. And what this filter does, the filter on the inside does, is it concentrates a protein. It basically dehydrates this sample, it takes the water out of it, and leaves me with a highly anti-inflammatory protein called alpha-2 macroglobulin that I can inject to treat inflamed areas. So after I spin the blood, it ends up separating into red blood cells down at the bottom and plasma down up at the top. It's this gold stuff and this white cloudy layer that I use to help treat people's pain and injuries. Why do I use ultrasound and x-ray, and when do I use each one? So if I'm doing a joint injection like I'm doing right now, you can see on the screen there, x-ray is easier for me. You can also do this under ultrasound, so whatever your comfort level is fine. I trained with x-ray, so for joints I like to use x-ray. Now, if I'm doing soft tissue or tendons, right? So if someone has a rotator cuff injury, if they have a bursitis or something, to treat the tendons, I would need ultrasound. And then, because ultrasound will show, under ultrasound, I can actually see the soft tissue. With x-ray, you can only see bones. So if you're not treating bones, we need ultrasound. Dr.
Hey guys, I just got out of my PRP session where Dr. Goyle injected my own platelets directly into many different areas, muscles, joints. He also did some trigger point injections for those tight muscles. And now I'm in the recovery time, eating some snacks, and I'm gonna get a little glutathione push to help get out of the anesthesia a little quicker, but also to be tip-top condition.